everyone that has come out today for what I hope is a long-term commitment to this initiative, which is our first annual Fentanyl Awareness Safety Fair. I am Anne Marie Schubert, and I have the honor of being the Sacramento County District Attorney. One only needs to see the t-shirts that family members are wearing today to understand the magnitude of this problem. If you look at some of these shirts, you might see something that says, "Ask me about my son." One only needs to sit with the family members that have lost their loved ones to an epidemic that is happening here in Sacramento County. I want to take a minute, first of all, to thank the Sacramento County Department of Health Services, their substance use prevention and treatment services, for partnering with our office for this safety fair. I also want to thank and acknowledge a number of special guests who have joined us here today to talk about this epidemic, why we are here today, and really the ultimate goal to save lives. First off, I want to thank Assistant Chief Deputy Tin Ho from our office, Behavioral Health Services Director Dr. Ryan Quist, Acting U.S. Attorney Phil Talbert, Sacramento County Board of Supervisors Patrick Kennedy and Rich Desmond, Laura Didier, who lost her son Zach, and Fire Chief Walt White for participating this morning. There's two numbers I hope people walk away with today in understanding the magnitude of this problem. The first is 98%. 98%. Talk to our crime lab folks over here about what that number represents. Of the street drugs that are taken off the streets here in Sacramento County, 98% are counterfeit, meaning that the people thought it was something legitimate and it's fake. But more importantly is 98% of those street drugs are fentanyl. That's a staggering number in our community. The second number that we must walk away with today is 186. 186 lives have been lost in our county since January of 2020 until a couple days ago because of fentanyl poisoning. That is more than the number of gun-related homicides we have in our community. It is a staggering number. It's also important for people to understand that this is hitting all different groups, demographics, doesn't care about zip codes or races or ages. It's hitting everything. I think our youngest child in our community that has died is 15. I saw an article the other day about a 5-year-old up north that had been exposed to fentanyl. Our crime lab is seeing an alarming rate of these counterfeit pills that are laced with fentanyl. Pills that one might think is OxyContin or Xanax or Percocet or Adderall, when in fact they're not. They're also seeing it in other substances such as powders. And perhaps most critically for people to understand is that it's less than one pill can kill. Our office, along with the county and many other community partners here, is working tirelessly, both in the courtroom and in our community. So when I say we're working in the courtroom, this is a message that needs to be told. If you choose to sell drugs in this community and you know those drugs have fentanyl and you kill somebody, you will be held accountable. So for those drug dealers that are pushing these pills on Snapchat or other apps, be on notice that if you choose to sell drugs that you know contain fentanyl and you kill somebody, you will be held accountable. Here in this community, We are addressing it through things like this. We are partnering with all of you, our community-based organizations, our county agencies, our board of supervisors, our law enforcement partners. It is critically important that we understand that this is a community project. I say this and I mean this, and when I end this. In the words of Nelson Mandela, safety and security don't just happen. It takes a collective consensus and a public investment. We are here today because of that collective consensus and our public investment. We are here to save lives. So with that, I'd like to now introduce Assistant Chief Deputy Tin Ho for a few words.
As the Assistant Chief Deputy District Attorney of the Justice and Community Relations Bureau, as a community member, as a parent, I've heard and listened to the heartbreaking stories of families who've lost children and loved ones to fentanyl poisoning. It's heartbreaking, but it is through that heartbreak that has inspired us to act with the urgency that this crisis demands. Over the next several months, the District Attorney's Office, along with our elected leaders, our partners in the health and education field and in law enforcement, will engage in a multifaceted countywide public service awareness campaign, a campaign that will involve not only flyers and posters and ads across multiple platforms, social media, print, radio, and TV. We will be partnering with the Office of Education for Sacramento County to make sure that all of the students in the county receive these PSA materials. The District Attorney's Office has devised a program called iSmart that we will be conducting and presenting not only to parents and students, and this is the message we will be giving. Fentanyl is flooding our streets. If the pill didn't come from a pharmacy, then it's fake. And if it's fake, it contains fentanyl. And one pill can kill. All it takes is a few grams of fentanyl to kill every single person here today. One pill can kill. So get educated, get informed, and then educate and inform your kids. And today, grab a Narcan kit. Why? Because it can save a life, because one pill can kill. To learn more, go to our website, onepillcankillsac.com. Onepillcankillsac.com. Because together we will end this crisis. Together we will make sure that not another family, not another community will suffer the heartache and the pain that so many of you have felt. Thank you for coming here today.
Thank you, Tin Ho, and thank you, District Attorney Anne Marie Schubert, for inviting me to participate today. You know, I'm the newest member on the Board of Supervisors in Sacramento County, and prior to that, I was with the California Highway Patrol for 24 years. I retired from that to run for office, and the last few years of my service in the CHP, we started learning about fentanyl, and usually in terms of officers being exposed to it and the concerns associated with that. We had some officers who almost died in the CHP from being exposed to very minute amounts of fentanyl. And of course, you started seeing, because of fentanyl, of course, and the larger opioid crisis, we started seeing the devastation on our freeways, certainly that it causes, the devastation from a law enforcement perspective. But now in my role here, I'm here with you today, and I've had the opportunity to speak to a few parents, and it personalizes it for me so much now, so much differently than it did as a law enforcement officer. And that's why I think this event is so important, because we need to personalize it. We need to bring it home for people so they understand that this is not just something that's limited to some kid who's growing up in horrible circumstances in the inner city. It affects everybody. It can affect everybody in our community. Not only the victims who we're remembering here today, but others who have children who are suffering from addiction right now, and how compelling it is for us to do more about this, to educate ourselves about it, and to do more about it. I'm very proud to be a member of a board of supervisors with one of my colleagues here today, where we just passed a resolution unequivocally supporting the efforts of the district attorney to have these educational efforts and supporting our county behavioral health, because it's our job at the county to administer support programs to help prevent these kinds of tragedies, to help educate the public, to help treat those who are suffering from opioid addiction. And with that, please spend time today talking to the family members who have lost everything as a result of this crisis. Get to know them, get to know their stories, and spread the word about this crisis that can touch every one of us. Thank you, Anne-Marie Schubert, Tin Ho, the District Attorney's Office, Dr. Ryan Quist from our County Behavioral Health for being here today and supporting this effort. And thank all of you for being out here.
So I'm here to tell you a story. It is a story that is being played out in households throughout this country every day. And it's the story of my baby, my son, Zach, who was such a special guy, just incredible kid. He was 17. He was a high school senior at Whitney High in Placer County in Rockland. He was just living his best life. He starred in the school musical. He was a hurdler on the track team. He played soccer. He had a beautiful, wonderful girlfriend, a circle of friends that were just tremendous kids. He was a straight A student. He was supposed to graduate as one of the valedictorians of his class. He was a self-taught pianist. He was just an amazing kid. So when he was found dead in his room on December 27th of 2020, we were baffled. What could kill our beautiful child? Fentanyl has changed everything. You may not get a red flag. You may not get anything that will indicate to you that you need to intervene. Your child is dabbling in something that could be harmful to them. He was dealing with COVID lockdowns. He wasn't able to do all of the things he was used to doing. And over the holiday break, after he submitted his UC applications, maybe blowing off steam, curiosity, and it ended his life because he didn't know about this danger. He thought he was taking a Percocet. We didn't know about this danger to warn him, to tell him what was out there. He got this pill through Snapchat. We're finding this story. We've now come to know all of these families who have the same story that we do. And when the coroner's office came to our home, and our family had to go outside, there was no injury to his body. There were no pills in his room. There was nothing. The first time I heard the word fentanyl was when someone from the coroner's office said, unless it was, an undetected health problem, we're gonna suspect fentanyl took his life. And I'm like, what the hell is fentanyl? And how could my child get enough of it to kill him overnight, 2 days after Christmas? That began our education. Our other 2 kids, Zach's dad, when we got confirmation that killed him, we all sat down and we said, we aren't gonna stop talking about this until every household knows about this. We've gotta end the stigma. We've gotta talk about what is happening. We've gotta talk about the dangers that our kids are being exposed to. Something that if he had done 18 months prior would not have killed him, because he probably wouldn't have not encountered fentanyl. So I am so grateful that you're all here. I implore you to take this information to people that you know that weren't able to come. On that demand reduction side of it, that is what our family has thrown ourselves into. We've partnered with a nonprofit called Song for Charlie. All of us are grieving parents who have lost our children to these deceitful counterfeit pills. These are poisonings. This is what we need to do, is update the language. These are poisonings. People are being deceived into consuming fentanyl, and it needs to stop. We are working to get education in the schools. Please come see us over here. Alex, maybe raise your hand. And Sam, my other 2 beautiful kids who miss their baby brothers so much and are working so hard. They came from out of town to be here for this, and they're handing out the information. We have curriculum ready to go. So if you have access to someone in your school district that is a decision maker, please get in touch with us. It's ready to go. It's free. You can put it right into your schools. Vista Del Lago High School in Folsom will be there on Monday. They made these shirts that we're wearing. They're doing awareness all over the school on Monday. We will go anywhere that will have us, and we'll hear our story, because we all need to know what's happening. And God bless you all. And I'm up here speaking for Isaiah, 15, who died in Sacramento. Jeff, 17, died in Elk Grove. Jade, 19, Elk Grove. I know I'm missing other parents, but they're grieving parents scattered throughout. And I'm so sorry, I can't think of everybody's names, but thank you so much for being here, and everybody learn about this and share the information. Thank you so much.
Good morning, everyone. I want to start off and thank Anne Marie Schubert for putting such a spotlight on this topic, and Tin Ho, of course, and the rest of the district attorney's office. This is such an important topic for our community. And I want to thank all of you for being here, and I want to thank our providers and other community members who have been dedicated their Saturday morning to setting up informational booths and bringing such an important spotlight to this important issue. I think it's really important. Laura, thank you so much for sharing your story. It is so important to put a face and a name on these tragedies. These are people in our community that are being impacted. You heard a reference to our purple flags here. These flags represent These symbolize fentanyl poisoning awareness and the lives lost to fentanyl in Sacramento County. They have faces, they have names, they have families. So we need to make sure that we keep that at the forefront of our thought. And now I also wanted, as a key point of my comments, what is, how can you get involved? How you spent your Saturday morning coming out here. It's clearly, this is an important topic for you. Please feel free to stop by our Sacramento County Behavioral Health Desk and find out about the important initiatives and coalitions that we have doing the work around this. And then the other thing I want you to pay close attention to is we're going to have a demonstration of how to administer Narcan. It's such an easy way to prevent a death. The most important thing is you have to have the Narcan. Once you have the Narcan, it's very easy to actually prevent a death. So if you have a lobby at work where the public accesses it regularly, that's where you need your Narcan. I typically carry Narcan around in my bag. It's a very small box. It can go pretty much anywhere. One of my colleagues told me he puts it in his glove compartment of his car. All you have to do is make sure that you have it available so that when somebody's in distress, you can help them out and you can save a life. So thank you for that demonstration, and please pay close attention to that.
We're not talking about something pharmaceutically produced by, and designed and intended for use as pain management, but we're talking about illegal street drugs that look every bit as much like a typical pharmaceutical pill that you might take. With that, we're going to try and make this as simple as possible. There's about 3 things that I want you to remember. First is that someone who is unresponsive, who is sleeping, should be easily aroused through what we would call a shake and shout method. We may go as far as first responders to do what's called a sternal rub to see if they're responsive to painful stimuli. But if they're still unresponsive after those activities, and you even suspect an opioid overdose, do not hesitate to use the Narcan nasal spray. Go ahead, Matt, if you want to demonstrate the usage. What he's doing is he's just placing the person in what we call a neutral or a sniffing position, taking the nasal spray, placing it in the nostril, and squeezing it just like you would any other nasal spray that you might take personally. There are no negative medical consequences for giving this to somebody who is not in an opioid overdose. Do not hesitate using yours should you have one, and we have them available here today. There's more that will be produced and made and provided. Lastly, I want you to know that even though a person may become responsive and appear like they are fine and they are out of this opioid coma, they still need definitive medical attention. The nasal spray may have half the life of the opioid or the fentanyl that they've taken. So it may only temporarily get them out of an opioid coma, only for them to relapse into one and die. Opioid suppresses the respiratory system to a level where the person will stop breathing. These medications have a purpose in our society. They're designed to provide relief from pain. However, if they're overused, overprescribed, or you get your hands on any of the synthetic product out there, one pill can kill. I know because it took the life of my own brother, who never had an issue with smoking or drinking, but he had an injury and he got prescribed opioids and he became addicted. And despite our best efforts and rehab, he had a relapse, and it was one pill that took his life. So first, if you can't arouse the person, you even suspect it, go ahead and use the nasal spray. There's no negative medical consequences for using it. And then even if they become responsive, they're still not out of harm's way. You need to get them, whether it was intentional or accidental overdose, they need the definitive medical and psychological treatment and care to get them through this crisis. The other thing to remember is don't touch the pills, because fentanyl can be absorbed through the skin. Our responders are at risk. They do wear latex gloves to try and reduce that risk. But fentanyl can be absorbed through the skin, whether it's the powder or the pill form. So do not touch the pills, use the nasal spray, call 911, and get them the definitive care as quickly as you can. Thank you for your attention today.